Nigeria has recorded more than 1,000 cases of COVID-19 since its first index case was reported in February. It's more than 2 months now, with rising confirmed cases every day attributed to community transmission. Today on Sound Health, we will take a look at how to halt the further spread of COVID-19 in Nigeria. I'm Olasumbo Modupe. Welcome to the show.
As President Muhammadu Buhari approved a phased lockdown in FCT, Lagos and Ogun State, as well as a 2-week lockdown in Kano State, Governor of Lagos State, Babajide Sanwo-Olu, has also introduced additional guidelines for the first phase of easing the lockdown. The guidelines is applicable to all sectors and the public service, while non-essential public servants from level 15 and above are expected to resume work. Others are to work from home. Banks and other private firms are allowed to open with a maximum of 60% of their staff strength operating within the hours of 9 a.m. and 3 p.m. Private companies are allowed to operate with a maximum of 60% capacity and strictly between 9 a.m. and 3 p.m. with joint transport system for workers. Markets will be open on alternate days. Food markets and stores will be open only on Tuesdays, Thursdays, and Saturdays, while non-food markets will be allowed to open on Monday, Wednesdays, and Friday from 9 a.m. to 3 p.m. All places of worship and school remains closed, while parents and school authorities are encouraged to dialogue on a way forward and see things from each other's perspectives. Governor Sanwo-Olu cautioned Lagosians to take responsibility by protecting themselves and loved ones from contracting COVID-19 by washing or sanitizing hands regularly, observe required distance in public, and wear a face mask. In addition, Sanwo-Olu released 3 telephone numbers for whistleblowing purposes during the phased easing of the lockdown: 0901 051 3197, 0901 051 3198, and 0901 051 3199. The Lagos State government is also expanding the capacity of isolation centers with more locations and medical equipment. Governor Sanwo-Olu affirmed this when he commissioned 118-bed Bagada Isolation Center. This brings the number of centers to 5 and about 3,500 isolation beds in Nigeria. Furthermore, the University of Benin Teaching Hospital Molecular Lab is ready for sample test collection in addition to the active laboratory test in the country. Meanwhile, the experimental drug remdesivir has been authorized by the United States regulators for emergency use against COVID-19. The NCDC says it is working with NAFDAC on accessibility in the country. Due to community transmission in parts of the country, NCDC has published a new case definition for COVID-19 in Nigeria. NCDC says anyone with cough and fever or history of fever in the last 2 weeks with one or more of the following symptoms, such as shivering or shaking, that is chills, body pain, headache, sore throat, recent loss of appetite, recent loss of taste or smell, difficulty in breathing, shortness of breath, diarrhea or abdominal pain, runny nose or catarrh, fatigue or tiredness, should call any of the toll-free lines. Over 3.5 million cases, more than 1 million recoveries, and about 240,000 deaths have been recorded globally. To date, more than 2,500 cases, over 400 cases were discharged, and above 85 deaths have been recorded in 34 states and the Federal Capital Territory.
It's still Sound Health on Lagos Television. Now, I'm being joined by Dr. Maduafokwa via Skype. Dr. Maduafokwa is a public health physician representing the Association of Public Health Physicians of Nigeria. Welcome to the show, Doctor.
Thank you so much for having me.
How are you doing?
I'm doing great. How are you?
I'm fine. I must commend you and
I
all.
hope you're staying safe. Yes. Thank
Okay,
you.
okay. I must commend you and other frontline healthcare workers working effortlessly to flatten the curve.
Thank you so much. I
Na-
appreciate that.
Okay, you're welcome. The World Health Organization in January declared COVID 19 a viral infection caused by coronavirus and zoonotic in nature. Months after the declaration, there has been different theories regarded as being more than a viral or respiratory infection. As an expert, what is your take on this?
Okay, so COVID-19 is an infection caused by a virus. It's definitely a virus. It's a coronavirus. It's called corona because the virus looks like a crown. So corona is from the word, crown is from the word corona. So this is definitely a viral illness. It's a whole family of viruses, and some of the illnesses caused by members of this same family would be like the common cold, obviously the SARS, we had the SARS epidemic a few years ago, the MERS epidemic as well. So all of them actually belong to the same family. So this is definitely a
Okay, some doctors abroad says COVID 19 affects the cell. Dr. Rashid Bota, an American osteopathic physician and conspiracy theorist from Charlotte, recently in a video claimed that Dr. Anthony Fauci's research helped create COVID 19.
Okay, so definitely, COVID-19 is a disease caused by coronaviruses. Coronaviruses are known to be, some members of the family are known to be zoonotic infections. Basically, that's viruses that affect animals but can be transferred to humans. So
Okay.
COVID-19 is suspected to be one of them. However, currently, we haven't been able to pinpoint which animal it jumped from. But definitely, I would not blame Dr. Fauci for this current pandemic. And there are lots of conspiracy theories, I know, but we can definitely say that this um, current pandemic was not caused by Dr. Fauci or anybody in his research team.
Okay, there are reports of discharged patients experiencing loss of languages. Some discharged patients also experience organ failure. What's your take on this?
Okay, so this is a new virus. We call it a novel virus. So that means it's new. When we're still studying the effects of the virus, we're still studying the after effects of the virus. So there have been some cases of cardiac involvement. There have been some cases of neural involvement. But so it's going to take at least a year of studying these cases, studying the sequelae of this infection for us to be able to say, okay, so this is what happens after you recover from COVID-19. So this is still early days yet.
Okay, we now have more cases every day. What could be the reason behind community transmission?
Okay, so community transmission is when, because we traditionally know that this infection has been sort of imported from abroad. So community transmission will be someone picking up the infection with no history of travel and no history of contact with someone that had just traveled. So that is what we call community transmission. We're seeing the numbers going up and people are sort of concerned. But people have to understand that we're doing a lot more testing now. So there's something we call surveillance and contact tracing. So
Okay.
surveillance is you're looking more for it. So when this whole thing started, I think we had 4 or 5 testing centers in the entire country. But today, there's a testing center in each local government area in Lagos at least. And we have about 20 local government areas. So there's a lot more testing going on. So the more you test, the more you find. So that's really one of the drivers behind the rising numbers that we're seeing.
Okay, Dr. Maduafokwa, what is your assessment of ongoing efforts by the government? Scientifically, are we doing enough in terms of flattening the curve?
Okay, so flatten the curve, there are certain measures that need to be put in place. One is the physical distancing, which the government has really pushed with the lockdowns in different states, which is really, really, really healthy. We know that has worked. Even the pandemic of 1918, it was physical distancing that actually helped to curb that pandemic. So that is one measure that is actually working. Another measure that is being pushed now, and from research we found out wearing a mask protects not just you, but it protects people around you. So that's another measure that the government is also pushing. Another measure the government is pushing is this surveillance and contact tracing. Because if you can find the contacts of the people that have the infection, then you can quarantine them, you can monitor them to see if they develop the infection, and you can keep them from infecting other people. So these measures by the government are actually being very effective.
Okay, according to reports, culture, myths, and misconceptions are major factors hampering ongoing efforts to flatten the curve. What can be done to dispel these myths?
Okay, so you raised a very good point, and it's a very, very good question, because when you want to bring about a public health change, which is what we're trying to do, there's something we call community mobilization.
Mm-hmm.
So you can't just come and prescribe to people and tell people just stay at home and leave it at that.
Okay.
So we there's something we call entry points to every community. So for any community, we need to find the key opinion leaders. So it's when we get to the opinion leaders and we get their buy-in to understand exactly what we're trying to do. And that's how you from them, you now trickle down to members of the community. So those are the people that they trust. They can dispel some of these myths. So if I come from nowhere and start telling people in the community, oh no, this is a myth, they're not going to believe me. But if they're leaders, people they trust, the youth leaders, the market women, their market leaders, that's how you get communities to buy into public health initiatives. So one thing that we need to push very, very strongly is community mobilization.
Okay, one of the strategies the Lagos State government initiated amidst the lockdown was active case search and decentralized sample test centers. Do you see them effective in containing the spread?
That's absolutely effective, because the more cases you can identify, then the more the better it is for you to find out who those cases have been in contact with.
Okay.
Then you can either quarantine the cases depending on if they are like high risk contacts or medium risk contacts. You'll be able to now quarantine these cases and keep them from infecting other people. So case search, surveillance, these are key protocols that the government has actually ramped up on, and it's very, very effective.
Okay, in addition to this, government has also mandated the use of face mask. Will this help? Will this help? And what is the specification? Can any material be used to make one face mask? Can I just go to the market to buy any material to make my face mask?
Okay, that's a very good question. I mean, in an ideal world, everybody will use high-grade surgical masks or N95 masks that have micro filters to filter out small particles. But we're not in an ideal world. However, any mask is better than no mask.
Okay.
So which is why they're saying even if it's cloth masks, whatever fabric you can, it will give you some protection. It might not give you as much protection as, say, an N95 mask, but it's better than nothing at all. So we're encouraging people, you can make your own masks. People are being very creative. People are using Ankara. People are making fashion statements with it, to be honest with you right now. So it's better to have some protection than to have nothing at all.
Okay, is it true a treated COVID-19 patient can be reinfected? And what is your... Okay, go ahead, please.
Okay, so like I already said, this is a new virus, so we're still studying this virus. So this virus, like I already said, belongs to a whole family of viruses. If you say the common cold as an example, you can get the common cold. So you get it in March. You can also get the common cold again in, say, October. So it doesn't give you lifelong immunity like, say, measles or some of those other infections.
Okay.
So right now, we suspect that you don't get lifelong immunity from after you've had the infection. But we
Okay.
need to study this for at least a year or two to be able to say for certain that you don't.
Okay. What is your take on COVID-19 patients who refuse to share their health history with healthcare providers, thereby jeopardizing the frontline workforce?
Okay, so we've noticed that this is sort of becoming a trend, and we've also seen that it's happening more in this side of the world.
Okay.
It looks like in the West, people are really open to share their experiences because that will help people. But here, there's a lot of secrecy, and it's not very useful. So
Okay.
our work as public health professionals or healthcare professionals in general is to sort of destigmatize COVID-19.
Okay.
To say, hey, if you have a cold, you're not going to be hiding it. You know what I mean?
Okay.
So it's our job to say, you don't have to be ashamed of this. It's not a sexually transmitted disease. You don't have to be ashamed to say that you had COVID-19.
Okay.
I think that will sort of make it easier for people to come out and share their experiences and definitely help other people.
Okay. Dr. Maduafokwa, what is your view on funeral rites and bodies of COVID-19 patients? I'm talking about the management now.
Yes, I completely understand. So the NCDC has guidelines as to how COVID-19 patients that have passed on, how these bodies need to be handled, and the practices need to have at the core. We need to remember that even though the patient has passed on, the patient can still transmit the infection. So the guidelines have to be followed exactly as prescribed by NCDC, with people handling the bodies, wearing protective apparel. They need to also bear in mind that family members and sometimes some cultures have different funeral practices. So we need to also bear that in mind and be able to get their buy-in to understand that, yes, we want to honor your practices, your culture, but we also want to protect you. We also want to make sure that the people that, the loved ones that have been left behind are kept safe. So these practices have to be followed as NCDC has prescribed, but they have to be followed, taking the cultures and practices into consideration.
Okay, a quick one now. I'm sure you are aware of happenings in Kano State. As a medical
Yes.
expert, can you please give insights? Because we don't have a grip on what exactly is happening there. The authority there has already said it has nothing to do with COVID-19. The deaths recorded are not related to COVID-19. As an expert, what's your take on that?
So the medical community as a public health practitioner, when I see that number of deaths in a very short period, there needs to be an investigation. What people are waiting for is the testing for COVID-19 that should already have been carried out. So, because in the face of the pandemic, the index of suspicion should be very high.
Okay.
For that number of deaths in a short period. So that definitely must be investigated. So we can't just take somebody's word. Let me put it, we can't take your word for it. It's like saying a murder has been committed and we're just going to take your word for it. No, we need to investigate and to actually get to the bottom of it and convince ourselves that this is not what it is or this is what it is. So there needs to be an investigation done, and one of the tests that need to be carried out on some of these people that have passed on is the COVID test, that's for sure.
Okay. What should we expect in days to come and your advice to the public?
Okay, Okay, so my advice to the public is to adhere to the prescriptions of the state government, the NCDC. Right now, one thing that we see that is working is physical distancing. So people should remember the basics. Stay at home if you don't need to go anywhere. Wash your hands with soap and water regularly. If you don't have access to soap and water, use alcohol-based hand sanitizer, at least 60% alcohol-based hand sanitizer. Cough into your elbow if you need to cough. Do not cough into your hand or cough into a disposable tissue, and dispose of the tissue safely immediately. If you do have a cough or a cold, wear a mask, stay at home, try not to be in contact with people. So these are some of the things that we have to just keep doing. We have to keep stressing it. Also, if you notice that you have symptoms, fever, now we broaden even the symptoms of COVID-19 to body aches, chills, even gastrointestinal symptoms. You call the NCDC. You don't go to the hospital because you put more people at risk. So these are the practices that we need to keep stressing and we need to keep hammering on.
Okay, finally, as we wrap up this segment now, I have this question for you. As an expert and as a Nigerian, do you think there is need for a relaxation of the lockdown? Do we need to relax the lockdown? Should we have a partial lockdown or a total lockdown? Is there need for that, any of that now?
Okay, so this is an argument that has been going back and forth. There are pros and cons. So there's lots of people on either side of this argument. So the people that are on the side of relaxing the lockdown are saying, and rightly so, that the economic situation of the average Nigerian, we know that 80% of Nigerians live below $1 a day. So the economic situation would make it difficult for people to be locked down for an extended period. But then people on the other side of the aisle are saying, if you look at some of the countries or the cities that have relaxed their lockdown and had immediate, there's a city off of the coast of Japan that relaxed their lockdown and immediately had a second spike of cases. So they look at such cities and such places and say, hey, maybe we need to hold on for a little while longer to make sure that we bring the cases down to very minimal levels. So there are different sides of this argument. And to be honest with you, we're currently on lockdown. We're seeing some success. I think the Lagos state government is on the right track. Let's see how it goes.
Okay, Dr. Maduafokwa, we appreciate your expertise on how to flatten the curve of COVID-19 on the program.
Thank you. Thank you so much for having me. Okay. Have a great day.
Okay, you're welcome. Dr. Maduafokwa is a public health physician representing the Association of Public Health Physicians of Nigeria. Dr. Maduafokwa has been speaking to us via Skype on how to halt the further spread of COVID-19 in Nigeria. Sound Health continues in a moment with trending health reports. Please stay with us. Every 5th of May is observed as World Asthma Day, dedicated to efforts on raising awareness and care about the respiratory condition. Details in this package. say thank you on today's episode of Sound Health. Please ensure proper use of your mask alongside other precautionary measures such as proper hand washing and social and physical distancing to beat COVID-19. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social. #SoundHealth. A sound health is a sound mind. Make healthy living your choice.